Oh, simulation is super important, and there's some different ways that it could look. So one of the things that we see is by having a high-tech centralized simulation lab, we can offer a very realistic training environment. So people can get their skills in a place that looks and feels like a hospital. At the same time, we also need to put that simulation equipment in clinics and in the hospitals themselves, because we want to be able to teach real time. And so we use simulation training for many of the skills that are necessary to take care of critically ill patients. Airway control, meaning allowing them to breathe on a ventilator. One of the things that we do for people with severe COVID is that we actually find that spending time on their stomach and ventilating, it's called proning the patient, is important. Well, in many cases, we practice that using mannequins before we do it on real people, just to make sure the entire team is coordinated and functions as a single unit. So we also want to put these simulators into the hospitals so that we can practice skills on site before they're needed, or we can use the simulators to train people in improving their skills after a situation. We use simulators in the hospitals so that we can be prepared before an emergency arrives, and we can provide excellent care that way. And it's really been effective. And one of the things that I look at as having been involved with the foundations for years is that this is something that benefits everyone in the community, potentially including me. That by me investing in this and donating funds, there is a possibility that next week I may need this service. I may need skills that are improved by virtue of the simulators. If I can benefit from this, or my community members can benefit, then I think we all gain. And it's just a wonderful investment in the long-term healthiness of our system.